Hi, Dr. Paul here. Welcome to another episode of Ask Your Pediatrician. We have a rash for you today that is so classic. I wanted you to see this. I'm going to hold back on telling you what it is, see if you can figure it out. Nicholas has been kind enough to let us see this rash and use it as an opportunity to educate you, the world, and the viewers. Thank you, Nicholas. Appreciate that very much.
That's what I'm here for.
Thanks, man. So, Nicholas, you saw me about a week ago, I think, right?
Yes, that is correct.
And so I saw Nicholas about a week ago. He came in with a horrendous sore throat.
It was pretty awful.
It was awful. And did a full exam. He had, large red tonsils. They were a lot of pus and exudate on them. We sent it for a rapid strep. It was positive. We thought, oh, great, we got strep.
Yeah.
Here's your amoxicillin. Now, you can use penicillin, ampicillin, amoxicillin. I don't use ampicillin. And usually it's fine. If you've documented it's strep, within 18 to 24 hours you get better. And then what happened?
Well, this started to happen.
Okay. And this was, when did that start?
I would say that started a few days ago.
Okay. And I think you were saying it started, was it up on your face? And
It's only on my face as of today.
Oh, okay.
It started in my chest right here.
Can we see how bad it is on your chest? Wow, that is impressive.
It started right here.
Yeah.
With a very, very light coating, more like what you can see right here actually.
Okay.
And then it slowly spread and got darker. Spread down my forearms first,
Yeah.
very lightly, which was yesterday morning, and then by that evening it was much thicker, and then when I woke up this morning I was full spotted mode.
Wow. Thank you so much. You can put your shirt back on if you like. Does this itch?
Actually very little,
Very
surprisingly
little.
enough.
Okay. And so I've re-examined today, and the throat still looks horrible. So if you don't mind opening as wide as you can and say, ah. That's a very angry red looking throat. 2+ tonsils. The uvula hanging down between the tonsils is quite red. And not so much exudate anymore. We've also, you see, poor guy here, we've already taken a blood sample real quick, and I've run a CBC, which is a complete blood count, and a monospot to look for mono, and sent off a more comprehensive lab for Epstein-Barr virus, so we can see if you have mono, how far along is it, and that's something we can track if for some reason you're not getting better. Turns out you do have mono.
That's not good enough.
So for those viewers who were wondering what this rash was, I'll now let you know. This is classic mono, and you take either ampicillin or amoxicillin. So I remember when I was in residency training, there was a big push, use penicillin to treat strep throat, because it's not very likely you're going to get this reaction. This reaction will happen about 90% of the time in ampicillin treated patients who happen to have mono. It's the whole reason we do a strep throat first. So I swabbed your throat.
Yeah.
I knew it was strep. I thought I'm golden. I'm okay using amox. So you can treat amox with twice-a-day dosing. And but unfortunately, you had both strep and mono.
That's a wonderful thing to hear.
Yes. I mean, the good news is we know what's going on.
Yeah.
Now, when I look at your blood work, your white count's okay. You have a very, very high lymphocyte count, which is what you're going to see with a mono illness. And the other thing I'm going to look at is platelets, which are okay. 147,000 is fine. Rarely with mono you can have a low platelet count, and that can be dangerous, but we're okay there.
All right.
If you don't mind, I'm going to ask you to hop up on the table. I need to feel for a spleen. With mono, you sometimes will get an enlarged spleen. So put your head there and scoot your feet down this way so you can keep your legs bent. Perfect. And then just try to relax. The key with the spleen is in the left upper quadrant, right there. Does that hurt by any chance?
It's a very small amount. I can feel it though.
You can?
It's
All right.
distinguishable differently than the other taps.
That's interesting. So you take a deep breath and out. And I ease my fingers up towards, again, deep breath. And I ease my fingers. Now I am just feeling a probable liver edge right down there. Here's his ribs, left lower costal margin, right there. I'm tapping at the edge of his spleen. So it's about 3 or 4 centimeters below the left costal margin. Nothing to panic about.
All right.
All right, you can hop up. One of the key things with mononucleosis, which is Epstein-Barr virus infection, other than if you develop like brain symptoms or other symptoms, which is, I never see it, don't worry. But spleen involvement's common. Are you an athlete?
I work out on occasion.
Okay, you're not playing like football right now?
No. I play ultimate frisbee. That's the only sport that I play.
Okay, ultimate frisbee, as long as you make sure it's not a contact version.
There is no contact.
Okay, good. Frisbee. So if you were to take a blow right there, right to the below your ribs where I was finding your spleen tip, the spleen gets swollen with this infection and there's an excess amount of blood in it and becomes a little more fragile. Okay. If you went bam, like you fell on a sharp object, took a football hit, or a baseball or something like that, that could rupture your spleen.
Which would be bad.
Which would be very bad, very quickly. So
all right.
We do not want anybody taking contact sports if you have an enlarged spleen and you have mono. So usual the follow-up is come back in a month, let's see how you're doing. Obviously, if you get new symptoms, I want you to come back right away. Yeah. This rash will probably last a week to 10 days. It's relatively harmless, even though it looks horrendous.
Yes, I
noticed that. If this had been 50 years ago and you had a lot of nasal congestion and some symptoms in your mouth, we might be thinking this was measles, but it's not. This is this rash that you get with mono and the presence of amoxicillin. Obviously, you're going to stop your amoxicillin. Yeah. I'm going to give you a couple prescriptions that might decrease the inflammation a little bit, but it's really not a big deal now that we know what it is. Okay. Other than just with mono, let me tell you one last thing about mono. Rest, 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 and fluids. Drink lots and lots of fluids.
Is there any particular fluid I should be drinking, or just
purified water would be great, but you really want to hydrate and you really want to rest. Right. Sometimes if you were, let's say you were an athlete and you were just pushing it, you can't let go of your sport, you would find out you're just wiped out. And that's going to make it harder for your body to recover from the Epstein-Barr virus, which is causing your mono.
I found even like walking up small hills to be very tiring.
Well, there you go. So that's not the rash, that's the mono. Yeah. And I've had many patients over the years who needed to actually take some time off of school. If you can go to school, well, that raises another interesting point. How is mono transmitted? Generally, it's by direct contact of secretions, oral, for example. You're not in college yet, but in college there's living in dorms and maybe a little more intimacy, kissing, blah, blah, blah. They used to call it the kissing disease. You can get it without kissing people, don't worry. But that's an example of secretions or sharing drinks, water bottles, athletes are sharing. So avoid sharing any secretions.
Any possibilities of that kind of stuff. Just try to stay clean as a general rule. Yeah,
wash your hands after being in the bathroom. Yeah. If you're coughing, obviously cover, don't cough on people. And if you had a fever, I would be definitely saying you've got to stay home, but so far you haven't had a fever.
Yeah, and I'm actually, unlike when I was originally starting, when I first got sick with the strep and stuff, I was feeling extreme exhaustion, like just an absolute disinterest in movement in any way, and that's almost entirely gone.
Well, good. Yeah. Well, sorry you got two things. That's just...
It's unfortunate, but it is.
Let's see each other in a month.
All right.
Sooner if you're having problems. Thanks for helping out with sharing that visual.
Yeah.
Picture says 1,000 words.
I'm going to call it the leopard disease.
Infectious mono when you're also given ampicillin or amoxicillin. Folks, this is the rash and it's classic. If you see this, check for mono. If you get the mono and they've been on antibiotics, amoxicillin or ampicillin, that's the cause. Thanks for watching. I'm Dr. Paul. Appreciate your viewership. Subscribe, share, and we'll see you next time.